Well, this is Trends. I am Bumi Urbano, and I'm pretty excited. The 5th episode of the program, and I'm not alone. I have Moses Omogena right here with me. Yes, Moses?
Yes.
Number 5.
Exactly. It's been 5 weeks already. I can't believe it.
Yeah.
It's good to be here with you guys once again. You know, what's been trending? I know that's the next question.
You know, what people talking about online.
Well, basically, you know, from previous week, from what we talked about, the Yali chat, the young,
it's still trending.
Young African Leadership Initiative, it's still trending. As a matter of fact, they're going to start up a new Twitter page or chat room tomorrow, 4th of April. But apart from that, social media seems to be having a very tense atmosphere now because of, you know, the crisis, in quote, that's going across Africa. It's the Ebola virus. You know, yeah, it has killed, you know, people, you know, lives and livestock have been lost. And so, you know, everybody seems to be on their guard and concerned about, which you will be talking in details.
Yes, I will. And remember, you can be a part of the conversation by sharing your views with us via Twitter at TVC Trends. You can comment on our Facebook page, facebook.com/TVC Trends, and send your pictures and video comments to the Trends at tvcnews.tv. Now today, the Ebola virus is certainly trending in Africa. Since it recently broke out, the Guinean health authorities have recorded over 122 suspected cases and over 80 deaths. Now, the World Health Organization says the virus outbreak has a fatality rate of up to 90%. This means that out of every 6 people with the disease, 5 will die. Now, for now, there's no treatment or vaccine for the virus. But apart from Guinea, there are also suspected cases in Sierra Leone and Liberia. Gambia has even joined the list. As a preventive measure, some neighboring countries are already closing their land borders with Guinea. In total, we have about 6 countries sharing borders with Guinea, so we can, you know, just think about the implications of this. But well, today, we look at the virus, how it has affected the social economic life of an average Guinean, what the government and several health organizations in the country are doing now to curtail the outbreak and calm Guineans who are understandably living in fear and tension. Whew, there's a lot to talk about. But first, let's take a look at this and we'll be right back.
An atmosphere of fear has pervaded Guinea, but wider panic has spread because of citizens' unfamiliarity with the Ebola virus. Business is at an all-time low of this motopark. Residents are especially scared to travel to areas where the disease has been prominent.
We have had less passengers since we learned of the disease. There are certain passengers who come to the bus station but don't travel any further because of the disease in the forest.
Experts have identified the consumption of bats as a risk factor.
Guineans should get into prevention. This prevention means in the first instance not to consume everything that is rodent and can carry disease. Unfortunately, they are still being eaten in forest areas.
In neighboring Ivory Coast, where bushmeat and forest rodents are a delicacy, no cases of Ebola have been reported, but the country has intensified an awareness campaign to discourage its consumption. The meat sellers are worried the government warnings will negatively impact on their livelihoods.
We are afraid because people won't come to buy our bushmeat anymore. What are we going to do?
This moment will pass. The government will tell the population that they can eat bushmeat again. For the moment, we are forced to abstain from consuming it.
Ivorian authorities have reinforced health checks at borders as most West African nations struggle to prevent the spread of the disease. There is no vaccine and no known cure for the Ebola virus.
Welcome back. I mean, I haven't had bats before, but I can imagine, I'm trying to think of a meal I particularly like and having to stop that because I'm terrified of contracting a certain disease.
I never even knew that, you know, that bats could be a delicacy. It's scary. You know, while I was watching, I saw where the woman was, you know, in the translation, she said that, you know, she sells bushmeat, but nobody wants to buy. Yeah, of course, nobody's going to buy. Nobody wants to stand the risk. And maybe she should stop selling the bushmeat.
Yeah,
and
but that's what she depends on that. But I can almost imagine looking at the picture already and seeing the different bonds, bats. Already I think about Ebola virus, and I do not want to, you know, even go near it. I can imagine how people feel about that.
Yeah.
Well, certainly there's a lot to talk about. Joining us to discuss this issue is Dr. Francis Faduyile, a consultant pathologist and also the chairman at Nigerian Medical Association, the Lagos chapter. We also have by Skype Benoit Carpentier. He's a senior communications officer, International Federation of Red Cross and Red Crescent Society, Geneva. We also have Unni Krishnan. He's the head of disaster preparedness and response at Plan International. You're all very welcome. It's certainly going to be a packed show already. I can feel it. So, Doctor, I'll start off with you, Dr. Francis.
Okay.
Help me understand something. I've heard a lot about this virus, but what makes it so unusual? There seems to be so much going on that people don't seem to understand. What is so unusual about the Ebola virus?
Well, sincerely, I would say that there is nothing majorly unusual about this Ebola virus, because worldwide we have not been able, man has not been able to dominate the viral community. Most viral illnesses have not been able to have obvious cure, though some of them we have had some vaccine, which is good and can control it. But the major thing about Ebola virus is that within a short period of time, it can cause a very high fatality.
So you're trying to say that the fact that it's a virus makes it very serious, irrespective of whether it's Ebola or whatever. But let's look at the atmospheric conditions that are pretty favorable for this particular virus.
Well, this virus has been linked to an area in which we have these fruit bats, because the fruit bats are the natural host of this virus, okay? And it means that once human beings get in contact with that fruit bats, it is likely that they transmit those virus into our system. Within the fruit bats, it does not cause death. It doesn't cause any illnesses for them. Okay, but for human beings, it causes illnesses and can lead to death. And after that, we'll have human-to-human transmission.
So basically, the animals just act as a host
of
the virus,
yes.
and it causes fatality for
human beings. And not only human beings, it also causes fatality for apes, chimpanzees, and some other animals. Like we have some strains
because
that
they share similar structure.
Yes, we have some that.
But aside the bats, you know, looking at the atmosphere in itself, do you think there are particular conditions that favor the virus, so it thrive more in this particular, probably a hot environment? Looking at West Africa is pretty tropical.
Well, certainly it is a tropical illness, and again it has to do with the cleanliness of the area, the environment, because it is usually seen in villages and in some small communities where they are not taking very good care about.
Okay, I'm going to hold you right there. Let me bring in Mr. Benoit into this. Mr. Benoit, can you hear me? Okay, can you hear me, Mr. Benoit?
I can hear you very well.
Okay, thank you once again for joining us. Now, you've been hearing the conversation, and we'll be talking about the Ebola virus, you know, and its, you know, disastrous outbreak across Africa. Now, it's been 38 years now since, you know, this virus, you know, has been discovered. And there seemed to be, you know, no scientific breakthrough. I mean, I quote, the World Health Organization says 1,560 people have died of this virus. And yet there seemed to be no formal clinical or even a vaccine against it. So what exactly is wrong? What do you think is the problem? Why is this a difficulty?
It's difficult to tell. I'm not a doctor, so I won't be able to tell you exactly, but on the clinical side, that could be the reason. There are mainly reasons that at the Red Cross we're working on a campaign that is called Silent Disasters, and for us, Ebola for now is not a silent disaster because it is a good thing, but it is in news, but it doesn't get enough resources as many other diseases for research. For prevention, and that's why maybe there's no vaccine at the moment.
Okay, we'll come back to you,
Mr. Benoit. Well, let me address the question to you now. He has spoken about the fact that resources are the reason why we still don't have a cure. But in your opinion, why it's taking so long to find even a vaccine for the virus, you know, for the disease?
Well, I think it borders on where and who are those affected, and the population. Apart from the case fatality ratio, which is very high. It affects a small area within the West and Central African country, which largely are resource deprived area. And if you have to get a vaccine for this, you have a lot of research to be taken into it and to be able to get a vaccine.
Okay.
And apart from this, before you can get a vaccine and have it to be administered to human being, it takes a quite long time, at least 10, 15 years. Okay, look at HIV AIDS, for example. It has been on a very long time, and there have been a lot of money being pumped into it. Up to now, we have not been able to have a vaccine that can take care of that. And that is to show that virus has not been something a disease
completely understood
that, that humankind can control and can make sure that they can take care of. We have some of them that we have had some good response from the vaccination.
Okay.
But
okay, let me bring in Krishnan into the conversation. Krishnan, we've had numerous cases of deaths and suspected cases of infected people, but I want to understand the demographics of the people that have been infected, because we haven't really heard of women or children, in particular children, because I know your organization focuses a lot about the well-being of children. So what is it like? A lot of children affected.
Okay, thank you.
You're welcome.
To begin with, this is a deadly disease, and we need to be taking this situation very seriously.
Exactly.
And unfortunately, as of now, this outbreak is not showing any signals of slowing down. So we must strengthen the response for this outbreak with the utmost urgency and seriousness. Ebola affects everyone. It doesn't show any specific preferences, but at the same time, because of the nature of certain groups of people, it is likely to have a strong impact on them.
Okay, Mr. Benoit, your organization is right there in Guinea. Could you please give us an update on, what's the development like? What's the atmosphere? Just paint a picture for us in Guinea as regards the outbreak and, your response to this crisis.
Yeah, it's a very difficult situation, and it is becoming more complex with each passing day. And we must recognize that it is no more limited to one country. And we already have confirmed the cases from one more country, and it definitely calls for a much stronger response. That's the first thing to remember. And there is a sense of panic, as well as lack of appropriate information is leading to a lot of rumors. And that's the last thing we need when we have an outbreak like Ebola. So the situation calls for strengthening clear messages and authentic messages about public health and safety at this point of time.
Okay.
Do you really think that the virus can be actually curtailed and been made to be extinct, really, for good?
Yes, actually, this is a difficult disease, and we must recognize that this is one of the diseases which clearly demonstrates the limits of medical science. There is no medicine and there is no vaccine. But at the same time, preventing the spread of the disease and saving thousands of lives is no rocket science. That is exactly what Plan International is doing in Guinea right now. By spreading messages of public health and hygiene, and by promoting hand wash and other simple health and hygiene measures, we can save thousands of lives.
Okay.
That's exactly what is needed there right now.
All right. Okay. One thing we all seem to agree about is that this virus and this disease is serious. However, the World Health Organization seems to be saying that it is serious, but it is not yet an epidemic. Let's listen to this sort.
What an outbreak is and what we are dealing with is limited foci, limited geographic area, and only a few, let's say, chains of transmission. For the moment, we speak of this as an outbreak. Ebola outbreaks are always of very high concern. Ebola outbreaks can never be considered under control until 42 days have passed since the last case.
Welcome back. Okay, before I ask my next question, I feel like I've abandoned my online community for too long, and they are the reason for the show. So Moses,
Exactly.
what are people saying?
They're itching to be heard. Our first tweet comes from Amy, and Amy says that the Ebola virus outbreak in Guinea is terrifying, with death rates up to 90%. And it's spread to new countries, 6 countries actually, if I might add. And our next comes from Lawrence. Lawrence says that Public Health England tells ITV News UK hospitals are alerted to watch for symptoms of Ebola in travellers from the West. So it looks like there's some extra care on those travelling from the West, from Africa.
People are certainly on edge right now.
Exactly.
Which brings me to my next question, and I'm addressing this to Benoit. The World Health Organization is saying it is an outbreak, it is serious, yes, but it is not an epidemic. What makes a disease
an epidemic?
Yeah. When should we get scared that, oh my God, this is an epidemic? How many people need to die?
What can be said about Ebola is that, as my colleague from Plan was saying, is that the way to control Ebola is not rocket science. There are very, very easy measures that can be taken. People, obviously, contact with people infected is the most, avoid contact with people infected is the easiest way to prevent from getting the disease. But what we're trying to work on is really trying to get information to people to avoid misinformation, to avoid stigma, which is a big problem with cholera. People that get whether cholera signs of cholera, even if it's not cholera, they get excluded from the communities, or if they go to the isolation centers and for any other disease like malaria, which presents the same symptoms than cholera at first, when they come back to their community, it's very difficult for the community to accept them. So this is something we with the volunteers of the Red Cross, we're trying to work very much on. And then there's the tracing of the people and trying to identify who's been in contact with people that could be infected by cholera. That's the most difficult thing because people are moving faster these days. And that's why in Guinea, the cholera outbreak in Guinea is one of the latest one that has the widest spread because people are actually moving and it's difficult to trace them. And because there was no Ebola outbreak in Guinea before. The first cases might have been diagnosed quite late because they could have been taken for malaria or for cholera because there was cholera outbreak at the time or measles outbreak actually at the time. So it's difficult if you don't take it from the beginning. So that's what we are trying to do, and that's why we've mobilized much more people. We are scaling up and we are mobilizing now 400 volunteers on the ground to try to trace people and to communicate to the communities.
All right. If there's one thing he pointed out was that information needs to be, people need to know what is happening. Let me see if all my reading helped. I know that the virus was discovered in Congo in 1976 and named after the river very close to where the first case was, recorded. And it can be transmitted by direct contact and bodily fluids. So we're talking about blood, urine, vomit, and so many other things. But you'll hear more after this break. Stay tuned.